"29-year-old Edita Kasangaki has been living with HIV for more than 10 years. She is the only one with the disease in her family, and she got infected after she was raped at the age of 9.
Nava kusomero mwana kati musirikala we yakola ki yanfunisiza obulwadde kati navaayo ne ntuuka waka nga nkaaba ne mbulira mama wange nazija nangamba toyogera mala n'oyogera omusajja oyo taata wajja kunzita.
Kasangaki was abandoned by her family, and she later dropped out of school in senior 2 after the HIV virus started taking its toll on her body.
Ate bw'ogenda mu ddwaliro n'obabuulira omutwe gunnuma ne bagamba nedda you will be fine. Tebakola body check up. Nalwala lino ebbeere limaze emyaka nga 6. Ne mbagamba nina ebbeere linnuma. Ne bampeereza obukeerenda butonotono bwe bati nenkola ki nimala nentambulamu. Era n'essaawa zino sente sikoze ki? Sizirina. Kati ndi awo ndinze Katonda yamanyi naye kyenjagala nga buli omu yenna tukwatire wamu. Tukole ki tukwatire wamu kana akawuka by 2030 tukamala amaanyi.
Kasangaki is one of many HIV/AIDS statistics in Uganda, a country where 137 people are infected with HIV every day. 44 of every 100 people contracting HIV every day are young people just like Kasangaki. And in general, 15,851 young people between ages of 15 and 24 constituted 34% of all new HIV infections in Uganda by 2017. And by December 2017, the burden of HIV and AIDS countrywide was past the 1.3 million mark, an addition of more than 100,000 to the infected people in 2011. The burden of the disease in the country at the time was evidenced by 13,000 men, 8,300 women, and 3,800 children who succumbed to HIV and AIDS. Following such statistics, in 2017, President Yoweri Museveni launched a fast-track initiative to end HIV/AIDS as a public health threat with key 5 points, including engaging men in HIV prevention and closing the tap on new infections, especially among adolescent girls and young women, accelerating implementation of test and treat and attaining of the 90-90-90 targets, consolidate progress on eliminating mother-to-child transmission of HIV, ensuring financial sustainability for the HIV response, and ensuring institutional effectiveness for well-coordinated response. Museveni, as chief guest at a function organized by Uganda AIDS Commission in Isinjiro district, told the local leaders, members of parliament of the southwestern region, and residents why he had rekindled the push to fight AIDS.
The message to the public got mixed up. All sorts of people came talking about things like circumcision. If you are circumcised, does your body become armored or what? That's how I came in now, recently.
The southwestern region of Uganda also happens to have a high prevalence of HIV. At 7.9%, it is slightly below the central region average, which is the highest at 8%. The national average HIV prevalence is 6%. Isinjiro district, which hosted the event, has a population of 540,650 people. 112 of these are refugees from various settlements like Nachi Valley. As of 2018, 113 people in the district have tested for HIV. 3,429 of these were found to be positive, and 7,022 females and 3,988 males are currently on treatment. Now, this means there is still a shortfall towards meeting some of the president's aspirations as regards ending HIV.
79% of the positive women were started on ART. Some refuse because they want first to go and ask for permission. You can see how this one is letting us down.
On viral road, I have told you, men are at 86.9%, while women are at 88, 88.5%, and the national target is at 90%.
One of the reasons raised by local leaders here as to why this southwestern region has a very high prevalence rate of HIV is the existence of refugees. But some members of the international organizations that carry out work in prevention and control of the disease claim this fact is wrong. Now, this is why South Sudan has an HIV prevalence rate of about 2%. The Democratic Republic of Congo has an approximated HIV prevalence rate of 3%. So literally, this means people from the Democratic Republic of Congo and South Sudan come from regions with very low prevalence HIV rates to Uganda, which has a very high HIV prevalence rate.
Think of any country around us, we have refugees from all those. So their backgrounds are certainly not known. And when they come, we don't put them into an enclosure. That's one thing that everybody must appreciate as to why the HIV prevalence in this region and in this district particularly at 6.3, I think is quite high.
The refugees are very compliant. In fact, most of them listen to us and adhere to what we tell them.
The Permanent Secretary in the Health Ministry, Dr. Diana Atwine, says the question of refugees is a complex one to deal with.
It is very difficult for us to plan for refugees because you don't know, and the numbers keep on increasing. Our prayer is that our neighbors will have total peace and they are able to go back.
In terms of financing efforts towards fighting HIV, members of Parliament on the Health Committee claim they have done their part and are only let down by the Finance Ministry.
We thought of 10 billion shillings, which we allocated to the AIDS fund, and the Minister of Finance is aware of this, but he has not responded as such. But what we need to have is around 700 billion to cover the whole country, because this is just a drop in the ocean.
I don't want to comment because the Cabinet passed and it was referred to Parliament and it is at committee stage. So what we are waiting for is to operationalize the AIDS Trust Fund.
Dr. Nelson Musowa, the Executive Director of the Uganda AIDS Commission, says they are on the right track towards meeting the 90-90-90 goals, but they are held back by a number of factors, including inadequate drugs.
There is complacency, there is low information and awareness about ways of transmission. And, when you combine all of those things together, you find that, the rates of HIV infection are higher than the national average. The Country Director of UNAIDS, Dr. Karusa Kirago, warns that failure to provide adequate commodities, especially drugs, poses a threat to treating HIV and AIDS in the country.
We do try to negotiate prices, to lower the prices of all these drugs, to make sure that the drugs are more accessible. But the more resistance you have, the more expensive the drugs will be and the more difficult they will be to get, to say nothing of the likelihood of transmitting a resistant virus.
Whereas the president is hopeful about ending HIV/AIDS as a public health threat by 2030, if there is no commitment to finding solutions for the existing challenges hindering the progress of his campaign, all efforts may result into a futile outcome. Walter Mwesije, NTV.